The course is called Bioengineering and Medical Surgical Sciences, which is, we call it as a supradisciplinary training in advanced technologies for new therapeutic approaches. What is behind the concept of this course is to, first of all, is worth saying that it is managed jointly, not only by Polytechnic Torino, but from the university in Turin. So we have a medical school in the university and an engineering school that meet together in this course with the joint supervising of many PhD candidates in order to train them both hands-on and within class training on the development of new technologies that can be applied to develop new therapeutic approaches. So to give a little bit more detail on the area that we are touching, we are strongly interdisciplinary, I would say. So we take together the typical and traditional competence that we find in medicine, so surgery, odontostomatology, anesthesiology, intensive care, imaging diagnostics, together. Let me take a pointer, maybe it's easier. Together with the traditional disciplines of engineering applied to biomedical science and technology, so mechanical bioengineering, biomaterials and biotechnology, and electronic bioengineering. Of course, these traditional disciplines put together, they are aiming at targeting in our PhD offer towards new sectors, new area of medicine, which are in many cases called also advanced therapies. So the use of non-traditional therapeutic means such as cells, genes, and nanoscaled formulations. So we will have advanced therapies, regenerative medicine, so the reconstruction of tissues and organs supported by engineering technologies, nanomedicine, which means developing instruments and therapies at the nanoscale, and robotic surgery, which is a big frontier of new big frontiers of surgery in which technology and advanced materials and approaches in imaging, in automation are applied in order to make surgery less invasive and more efficacious against in surgery cases. So just to summarize, we have an interdisciplinary joint program. It's very original. When we were asked to benchmark our course against competing initiatives in Europe and in the world, we had difficulty in finding similar examples. So we are quite difficult to benchmark. So if you join Polytechnic Torino, this will be quite a unique occasion to follow this high-level training for engineers, but also open to biologists, physicians, surgeons, and dentists. And in some cases, we have really offering an interdisciplinary training to these kind of students that will become then professionals that will be, of course, very, very likely to find a position either in the medical industry, in hospitals, or in advanced research and training in research institutes or universities. It's worth saying that we have activating this year a new curriculum with a medical university in Japan called KMU. So the idea is to have a joint track in which students will stay partially at Politecnico and partially at this medical school, and this will be another push to create not only an interdisciplinary training approach, but also an international an international course, a course and a training of international dimension. So this is mostly the story that I wanted to tell you. It might be worth adding that we have nice facilities to develop hands-on training and develop your own research project in your own PhD project. So we will have laboratories that ranges from the typical engineering laboratories, material science, so wet labs, dry labs, and we have created also an interdepartmental a center here at Polytechnic Torino, in which we host facilities for research in these fields, and of course with application in these advanced fields. And also you have big facilities also in the hospitals and in the dental school for what concerns the odontostomatology. We have on average around 30 students per cycle. They are supported by scholarship that, of course, in some cases come from universities, but we have a vivid interest from private companies that have activated several scholarship, either them with their own money or taking advantage of the instruments that at European and national level are available to co-finance this kind of initiatives. So we have also students, PhD candidates that stay for secondments that range from 6 months to 1 year in a private company, or that, and of course we encourage very much secondments abroad. In some cases, the type of scholarship as a sort of requirement to stay at least 6 months abroad. In the case of the KMU program, we'll have 1 year in Japan for the students enrolled here. Okay, I think that this was more or less the story. I will be happy to answer questions if there are any, either now or at the end of the session.
Thank you very much for the interesting presentation, Professor Ciardelli. Yes, we are going to answer questions in the Q&A session, but I have one question for you before we move forward to the next program. Your PhD actually represents an almost unique experience in the national third-level educational landscape. So in this regard, I wanted to ask you, what do you think are its elements of originality and attractiveness to fulfill the interest and also the aspiration of potential suitable candidates? Okay, so I think that some points were already touched in my previous speech, but what I would like to focus this, that our ideal candidate should be a candidate that is ready to overcome its current cultural limit towards a new environment. So don't be scared or let's say prevented to apply in case you think your training so far has not been is not sufficiently designed to join. Of course, you have to have some kind of background, either in one discipline of engineering cited here. Of course, if you have already had familiarized with the biomedical problems, that would make your life easier in the beginning. But in principle, we are very open to accept every kind of background, in technical background, of course. So physicians, but also biologists, biotechnologists, engineers, of course, but also we take people from physics and mathematics in some cases. Of course, that would be people that would like to explore the biomedical field, would like to develop new technologies for health. Thank you very much, Professor, for your answer and for the presentation.